All right, 8:20 in the morning, time now to ask the doctor today, and we are talking about pregnancy and being pregnant during those summer months here in the South. And Dr. LoRissia Autery is here. We just call her Reese. All right, 741-9272. Good to see you.
Thank you.
So you are a doctor, a private physician out of Walker?
Yes.
And but you deliver babies over at Brookwood.
That's it.
All right. Well, just as cute as can be, and she's here to answer your questions. And let's go ahead and get a phone call since we have some in, and then we're going to go over some of the specific things that we want to talk about. Who's our first caller, Suzanne? I'm sorry. Hey, Sheila. How are you?
All right. How are you?
Good. What's your question?
I was wanting to find out and see how many weeks do you have to be before you can find out how far along you are and all that stuff.
Okay, hey. Generally at our practice, like she said, I am a private physician. Hi, I'm a private physician at Walker Women's Specialist in Jasper and deliver at Walker Baptist, which is part of Brookwood Baptist Health. But we usually do an ultrasound on your first visit. We like for you to come in at least 6 weeks, and we verify that the pregnancy is actually inside of the uterus, that it's a good pregnancy with a heartbeat. We'll tell you then what your due date is, and then if there's any issues, we'll repeat that ultrasound.
We usually do an ultrasound on your first visit.
I think your TV's turned up, honey. If you want to turn your TV down, you won't get that feedback, and you can ask your follow-up question if you have one. Is she still on the line, Suzanne? Sheila, you still there?
Yeah.
Okay.
I am.
Did that answer your question?
The TV's turned up.
Yeah, I think. All right, I hope that answered your question. Suzanne, let's move on to our next caller if we can. And our next caller is, I don't have it here in front of me, I apologize. Hi, Anita, how are you?
Hi,
I'm
Anita.
good. How you
Good, what's your question?
Do a baby actively move when you turn 5 months? Do you have active movement?
Yes, ma'am. You actually can see movement on the ultrasound before 5 months. If it's your first baby, sometimes it takes a little while longer to actually feel the movement. During my pregnancy, it took me 22 weeks to actually feel her move. If it's your second or third pregnancy, you may feel the baby move a little bit earlier. Some may feel the baby move 14, 15, 16 weeks. At 20 weeks, though, you could definitely possibly feel that baby move.
Okay.
There's nothing like it.
There's nothing like it.
All right, thanks so much. All right, as we wait on our next caller to come in, let's talk about some of the things that you wanted to mention about being pregnant during those summer months. So staying hydrated any time of the year, but especially during the summer months.
Yes. I tell all of my patients that when you come in to see me, make sure you have a bottle of water with you. Just walking from the parking lot to our office, you can really get winded, dehydrated. It's very warm, very hot in Alabama during the summer, so dehydration can cause irritability in your uterus, contractions, and it sort of scares the pregnant patient. So we want to make sure you stay hydrated. It's good. Water's good for you, water's good for your baby.
Both of those. All right, invest in a maternity swimsuit.
Yes. Anything that's constricting just makes you feel uncomfortable. If you want to go outside and enjoy a pool, go enjoy the ocean, you want to be comfortable, maternity swimsuits are great.
They make such cute ones, too.
They make very cute ones. I did, too.
And that was 16 years ago when I had mine, so they're really, really cute. So get a maternity swimsuit. Suzanne, do we have a caller? Apparently not. All right, let's talk about napping.
Yes. It's great if you are able to nap throughout the day. If you're not and you work throughout the day, when you get home, try to take a nap. Just getting enough rest is going to prepare you for the rest that you won't get after that baby comes.
That is so true. And you'll get to a point that you just feel like you've just got to go to sleep at that moment.
Yes. Yes.
It's almost like being narcoleptic.
It is.
All right, the next one is keep your feet elevated. All right, let's go to Lucy. My producer says we do have. Okay, Lucy, go ahead. Lucy?
Yes, ma'am.
Hey, go ahead with your question.
Ma'am?
Go ahead with your question, hon.
Okay, I'm about 34 weeks along, and when I get really hot, my feet and legs swell, and I wanted to know if I need to take off work.
Hi, Lucy. Probably, unless you're having some very severe issues with blood pressure or have some placental issues, swelling is normal in pregnancy, especially during the summer months. My feet were swollen extremely early, and they stayed swollen throughout my pregnancy, and I worked until the day before I delivered. So as long as the baby's doing good, you have enough fluid, the baby's moving, then you probably can continue work. I definitely would discuss it with your doctor. Call our office, come in and see us if you don't have a physician, but staying up and active is just going to get you even more prepared for when that baby gets
It is
here.
a magical time. Going to have millions of questions if it's your first. One of the other things, get a massage, she says. Take a cool bath. That will help. We will have this posted at WBRC.com and on the WBRC News app as well. Just some advice. But Dr. Autery, great to see you.
Thank you.
Thanks for coming by.
Thank you. Nice to be here.
All right, now here's Jay.
They're the worst.